To move the amendment. Mr Durkan.
I rise to propose the amendment, and I welcome the DUP's support for it and welcome their motion itself to give us the chance to debate this extremely important issue. Any initiative that should ensure ethical and sensitive action on increasing organ donation must be supported and indeed embraced by this House. It is most welcome that the Minister has previously publicly stated his commitment to increasing the number of organ donors in the North. As of 2 weeks ago, there were around 500,000 people residing in Northern Ireland who are on the UK organ donor register, and I would like to acknowledge the altruism and foresight of these people at this stage. And we must also acknowledge the efforts that have been made to educate the public on the importance of organ donation and to attract people to sign up as donors. However, while we have seen an undoubted increase in the number of donors, it has not been fast enough, and it has not managed to address our need. Ironically, the fact that healthcare has improved so much has led to higher life expectancies and perhaps a lower rate of registered donors dying. Whatever the situation as it stands, while we still have hundreds of people on waiting lists for life-prolonging, life-improving and life-saving transplants, I know other speakers will focus on the suffering and anguish of these people, and this amendment explicitly sets out to alleviate this suffering. We cannot let people wait for heart, liver and kidney transplants. They don't have time to wait. Patients with acute liver failure die within 72 hours without transplant. In 2006-2007, 3,000 patients' lives in the UK were saved by receiving an organ transplant. Sadly, 1,000 died whilst awaiting such a transplant. We must deal with this issue as a matter of urgency. It truly is a matter of life and death. Another area that gives us cause for concern is that in the absence of a sufficient number of deceased donors, there has been an increase in living donation. Although this is, for some, a life-saving option, it is unfortunately one that carries high risks. The risk to the donor fluctuates depending on the organ, and it is obviously one that brave people are prepared to take to save a loved one, but it is a risk that we want to avoid in the interest of public safety. The National Institute for Health and Clinical Excellence has identified the need to consider organ donation as part of the usual end-of-life care planning. They have identified that where someone has not got the sufficient capabilities to make decisions about the end of their lives, to seek to establish before death a way to facilitate organ donation that is in the interests of the patient. They have also identified that consent should be appointed before death or from a representative afterwards. We are duty-bound and morally obliged to explore the options available to increase the number of transplant donors in Northern Ireland. Recommendations from the Organ Donation Task Force stress the importance of organ donation being a UK-wide service and coordination between locally based doctors and coordinators across the UK. I would urge further coordination and cooperation with the Dublin Government on this issue also, and I commend the Minister on his attitude and actions with regard to North-South cooperation on healthcare issues. The Welsh Government are currently undertaking an approach based on a soft opt-out system, which sees the removal and use of organs and tissues as permissible unless the deceased has made their objection to this clear during their lifetime. Presumed consent. Now is the time for Northern Ireland to take a similar investigative approach to such options. I am aware that other countries have legislated for opt-out system for organ donation, In Singapore, for example, the introduction of the Human Organ Transplant Act has seen a huge growth in survival rates from deceased organ donation transplants. And closer to home, European countries have also seen similar correlation between legislation and donation. You know, Mr. Ross intervened that this isn't always the case. I don't think anywhere the system, an opt-out system on its own, will suffice. There has to be ongoing education as well and coordination, as Ms Ramsey had pointed out. But we must also be cautious of such change as well, given the fact that in the UK, 40% of cases, relatives do not consent to donation. It is a very sensitive issue at a very emotional time for families. This highlights the need to ensure that whatever path we do go down, that we do so completely ethically and affords sensitivity to families of deceased people. We believe that campaigns to promote organ donation and encourage organ donors are to be supported fully, and I would take this opportunity to encourage the public and indeed every member in this House to make sure they are signed up and to carry a card. You could save or transform someone's life.
Order. The Business Committee has arranged